I'm Dr. Christopher Mullane, and today I'd like to share with you the most common causes of scoliosis and, in my experience, the most effective ways in treating the problems associated with it. Now, scoliosis occurs due to three reasons. There's a genetic reason, there's a traumatic reason, or there's an idiopathic reason. Now, the first genetic reason. Now, what that means is there's a family predisposition to it. It means you're born with it, and it's kind of passed down from generation to generation. Now, a traumatic reason would be more in the form of like a fall or a car accident, creating an injury or a fracture to the spine and causing the spine to then form a scoliosis. And then the third cause would be something called idiopathic. Now, what that means is we're not really sure what's causing it. We know that the scoliosis is there, but we're not really sure, what caused it. So it's not due to a traumatic accident, and it's not due to genetic reasons. So next, I'd like to describe a little bit about actually what scoliosis is. So scoliosis is an abnormal curvature of the spine, and it's moving from a lateral position or side-to-side curvature. So the spine should normally be in one position. In scoliosis, it curves to the side a little bit excessively. And it creates a lot of pressure and tension, especially into the joints, the nerves, and the discs in the spine. First, the joints, they can, accumulate pressure due to scoliosis in a number of different ways, but primarily they get restricted and they don't move and function properly. And this is going to create pain, it's going to create muscle spasms, and it's also going to cause the person or the patient to not be able to move as freely as they would like to. The next thing I'd like to talk about is the nerves that can be affected. So when you have that side-to-side curvature, the nerves can get pressure or they can even become pinched. And essentially they can cause shooting pain to different areas of the body. They can, restrict motion, but they can also accumulate muscle tension and muscle spasms as well. And then the third thing that gets typically affected are the discs into the spine. So the discs, they kind of separate the bones a little bit. So when the spine's not in its right position, meaning it's more off to the side, those discs have a little bit more pressure than they normally should. And it can create an injury in the form of a disc bulge or a disc herniation, which can lead to, of course, pain, reduction in range of motion, and also muscle spasms and tension associated with it. So kind of in summary, the most common symptoms that we see are pain, muscle spasms, and a reduced range of motion when a person comes in with scoliosis. Now, there are three common treatments and effective treatments that we like to use with these patients. Now, this is being chiropractic spinal manipulation being the first, electrical muscle stimulation being the second, and the third being intersegmental traction therapy. First, the spinal manipulation. It affects the joints, the joints of the spine, the disc, and the nerves by specifically targeting those areas and reducing any pressure and pain, as well as the muscle spasms and muscle tension. And now you'll be able to move a little bit more freely. The second therapy I like to talk about is the electrical muscle stimulation. Now, what this does is it applies a gentle electrical current to the affected area. Now, what this will do is it will decrease any inflammation, muscle spasms, swelling, those type of things, which will ultimately decrease your pain and help you to move a little bit easier as well. And then the third therapy I like to talk about is intersegmental traction therapy. What this does is it tractions the joints away from one another, allowing for a little bit more space, and so it'll reduce the pressure being placed on the joints, nerves, and discs, which will alleviate any pain. It'll help reduce any muscle spasms that are occurring, and also it'll help you have a better range of motion. So kind of in summary, these three therapies, when combined together, can drastically reduce or stop pain. They can reduce any muscle spasms, and they can also help you move freely and have a better range of motion. So this means to you a couple of different things that are very beneficial throughout our day-to-day activities. First, your work activities. You're going to be able to go off to work and not have the same problems as you normally would if you are affected by scoliosis. So you can perform better. You can effectively do your job a little bit easier because you can move freer and you won't have the pain. Second, you'll be able to sleep better throughout the night. Scoliosis patients have a hard time sleeping because any type of motion when they turn or bend is going to create a little bit more pain. So by reducing that, it'll help you get a better night's rest. You'll be more refreshed in the morning after you're sleeping a lot better throughout the night. And then finally, your day-to-day activities, whether it's doing housework, whether it's playing with your kids, you're going to be able to do these a little bit easier when you're not having that excessive, side-to-side curvature, and when the spine's in its normal curvature instead of that excessive lateral curve. So In summary, we're going to be able to work better, you're going to be able to sleep better, and you're going to be able to do your daily activities a whole lot easier. So if you're being affected by scoliosis, you're having the common symptoms that we described, please give us a call so that we can help you. You can reach us at 803 599 5902.